For the few people that have been asking me, no, you didn't see pets on the show yesterday. SPCA is going to be joining us again in their regular spot, hopefully by next Thursday. But because we love our pets here, we want to keep them healthy. And towards that end, we've got Dr. Thomas Mulder joining us from Fairview Drive Pet Hospital with friend. You want to introduce our other guest, please?
This is Bella. Bella's been my friend since, well, 13 years ago.
Well, Bella is incredible because we've seen Bella. You're amazing. We've seen her running around. Yeah, you can come say hi to me anytime you want. Bella's just been moving around, and I guess, does she thank her lucky stars that she has a vet?
I think she does. I mean, her sister is about the same age, obviously.
Excuse me?
Her sister.
You have both?
I used to have both.
Oh, okay.
I found a new home for one of the two, because together they were a handful, and I was quite busy starting my practice at the time. Her sister, unfortunately, has some arthritis issues and stuff, but Bella still jumps in the back of my car with the vim and vigor of a puppy.
Now, you talked about your practice. How long have you been at practice?
I graduated in 1990, and I came to this area in 97 and started a small practice outside of the area and moved into the Brantford practice, the Fairview Drive Pet Hospital, in 2001. So. Now,
I love the topic we're going to get into today because I've run into it myself before, and I will always side on the side of panic. And the question du jour is going to be, when should I pick up the phone and call a vet? I mean, if it's happening at 9, 10 o'clock at night or something like that, if I think I'm seeing something, I know it's not a short answer, but what is the answer to that question for a pet owner?
Well, the simple answer is, when you're concerned, call.
Right.
I mean, you love your pet, you know what's going on, and you're going to pick up on things that I'm not going to. And so if I try to tell you, well, only if this is happening, only if that's happening, the reality of it is, if you're concerned enough to be wondering, you're probably concerned enough to at least call. And then we can give you the answers of specifically what to be looking for your concern. It's never wrong to do an examination. Never a bad thing.
And we had in the springtime with our current dog, her start to lick some adhesive we were working with. So right away, we put in a call to some animal poison line, and we paid some fee for it. We're not talking about the fact that to get some information on the phone is going to cost us money.
No. In fact, I always tell people the sooner you call, the less it usually is going to cost you. Our technicians that are qualified, similar to a registered nurse's kind of role, they're able to help you make those decisions. And if it's an after-hours concern, we have after-hours clinics in the area, and they're also able to help you figure out, okay, is this a critical thing or is this not? The most important things that you need to do on a daily basis is make sure you know your pet well. I mean, there's a brief exam that you can go over. We have a copy of that posted on our website of what to look for on a daily basis, so you know your dog, where lymph nodes are, where ears are, what ear infection smells like, and that sort of thing. And but the reality of it is, you know your dog, and when there's something not quite right, that's the time to get help. So
when you talk not quite right, it's the feed is off a little bit, not as active as they are. Are there other signs?
Signs of pain are probably the most important things to be looking for.
That's a tough one, pain.
It is.
How do you know? I mean, in some cases, they're more resilient than humans.
In many ways, they are. Yeah, you and I would cry over a sliver, where dogs, if it doesn't work, we go, ooh, it hurts when I do that. Well, dogs are like, if it hurts, I won't do that.
Right.
So you'll often see dogs limping along, and the owners don't really notice because they're not whining or whimpering. And so one of the biggest signs for arthritis is loss of function. So the dog wants to lay down more. I'll often see a dog in the practice will come in at 10 or 11 years of age. First thing they do when they get in is lay down. A puppy usually is all over the place, and so loss of function is one of the things to look for. There are a few times where they're in incredible pain. I've had dogs that have like a broken tooth or something like that. When they bite down, it hurts, and they will jump back then. But even with oral pain, a lot of times dogs don't show a lot. So it's lack of function. Obviously, if it hurts when you touch it, that's a sign as well.
Yeah, well, what about regular health care? We lost a dog to cancer last year, and we didn't notice this dog's weight loss until we went and saw extended family members. My mother turned and said, that dog's thinner.
Yeah.
And so what about healthcare on a regular basis to kind of know what the weight situation is? Because you obviously can't get Bella to stand on a bathroom scale.
No, but you can.
Oh, really?
Yeah, and you can pick her up. But the best bet is, again, we have scales in our office. Yeah, that's it, Bella. We have scales in our office, and we make them available to our clients all the time because, I mean, I can't tell the weight from looking at them either. But regular veterinary exams are very important because there's things that I'm going to look for that you're not even going to think about. And the scales are an excellent way to tell what's going on. Interestingly enough, a lot of families now have very accurate digital scales in their house in the Wii system. And so I've had a number of patients that have their own Wii Fit profiles set up for their cats or their dogs and that sort of thing.
Terrific. Come back and see us again soon. We're going to dive into some more topics, but really interesting today. Appreciate the time.
You're welcome. Thank you.
Dr. Thomas Mulder, we're going to be coming back on Monday. Enjoy your weekend, and thanks again for being here and doing it inside Brant. Oh, Bella's too cute. I'll be upstaged.
Do you want us to move the table back?
No, you can leave it here for now.
Leave it?
Yeah. Hey, what'd they do? Surprise you with no time cues in that segment? No, I know what those guys do to you. Okay.